This is Brittany Wastel, just continuing with the physical assessment of the head to toe. Going to proceed with the abdomen. Please put your hands at your side. Normally the patient would be laying down. Just looking at the abdomen contour shape, how the patient's kind of breathing, that he's not using the stomach. Any notable masses or hernias, anything like that. Then I'm going to auscultate with first the diaphragm of my stethoscope to all 4 quadrants, making sure that there's vowel sounds in all 4 quadrants. And then using the bell, I'm going to go to the right and above the umbilicus, to the renal artery, and to the left renal artery, and then to the aorta, noting any bruits or abnormal noises. Good. After auscultating, I'm going to percuss, noting tympany over air and fluid, and dullness over the solid organs, going all throughout the abdomen. Good. And then I'm going to use light palpation all around the abdomen. And then using deeper palpation, noting any masses or tenderness. And then deep breath in and blow it out. Palpate the liver. And then on this side, deep breath in and blow it out. And the spleen, and then I can do the femoral and inguinal, the femoral pulses and the inguinal lymph nodes. Then when the patient's in the lying position, it's easiest to check the range of motion of the spine. I'm going to lift the leg, noting any cracking, crepitus or anything like that when I do range of motion with the hip. I'm just going to feel the hips, make sure that they're the same on both sides. If you want to go ahead and put your legs down for me, I'll then move on to the, I'm going to do fine motor movement. So what I want you to do is take your index finger, touch the tip of your nose, and then touch my finger. Good. Good. I want you to run the heel of one of your foot down the tibia of your other foot. And then on the other side. Good. And then I want you to alternate fingers to thumb. Good. After checking the fine motor movement, I'm going to go on to the lower extremities. I'm looking at the color, any edema, distribution of the hair. I'm going to feel the popliteal pulses, posterior tibialis, and then the dorsalis pedis, giving those all a 2. To check the strength, go ahead and put that down. I want you to push out, good, and pull back, good. And then I'm going to do some passive range of motion with the knee. And then Anthony, if you want to continue doing that, good, noting any crepitus or cracking noises, which I don't. After that, I'm going to have you rise for me. And I'm going to have you bend down, touch your toes. I'm going to look at the spine, the curvature, any deformity whatsoever, which I do not see. Good, go ahead and stand up straight. I want you to rotate your torso. I want you to lean back. Good, and then do some lateral side to side bending. Good. The spine has nice curvature, there's no curvature noted. Then I'm going to test gross motor movements. I want you to walk to the abdomen just normally. You want to catch that. And then walk back heel to toe. Good. And then I'm going to do the Romberg's test normally for 20 seconds. Close your eyes for me. And here I'm noticing gait and any uncoordinated movements, which I don't see. You can go ahead and sit down. Throughout the whole thing, I'm watching Anthony's muscle coordination and movement. I would explain that the procedure is done and wash my hands. Thank you.